Welcome to the presentation, Emerging NCHA Data on Trans and Queer Student Wellbeing, which is being presented on August 15th, 2023. My name is Joanne Brown. My pronouns are she, her. I recently retired from my position as a nurse practitioner at the University of Kentucky, but I'm still actively involved in NCHA. I've had the privilege of working with both Blake and Lo through ACHA, and I'm looking forward to their presentation. You will find the post-test for CE credit and an evaluation survey by returning to this session in the ACHA Education Center. A preview of post-test questions is also available under the Handouts tab. We welcome you to submit questions at any time during the presentation using the Q&A pane in your Zoom controls. We will save questions for the presenters and answer as many as possible at the end of the presentation. Blake has more than 12 years of experience using public health strategies to improve the sexual health of young adults, with an expertise in serving the LGBTQIA+ students. For 5 years, he worked as an HIV prevention specialist at AVOL, AIDS Volunteers Incorporated, where he conducted outreach, HIV testing, and education throughout Central and Eastern Kentucky. He has been in the college health field full-time for over 7 years, serving as a health promotion specialist in the student health centers at the University of Kentucky and at the University of California, Davis. He served as the chair of ACHA's Sexual Health Coalition for 2 years and is currently chair of ACHA's Promoting LGBTQIA+ Equity Task Force. Lo is the Sexual Health and Relationships Program Coordinator for the University of Louisville. Lo began their career working as a patient educator and advocate in sexual health care. After leaving clinical work, they moved into HIV prevention, providing linkage to care services, HIV testing, and HIV prevention education in Austin, Texas. After earning an MSW from the Brown School at Washington University, specializing in sexual health and education, they quickly found their passion for working with queer and trans students in college settings. Alongside their student-facing work, Lo is driven to improve health equity on campuses through their work on ACHA's Promoting LGBTQIA+ Equity Task Force and advocacy at U of L. No one with the ability to control the content of this activity has a relevant financial disclosure relationship to disclose. So with that, I'll turn it over to Blake and Lo.
Wonderful. Thank you so much, Joanne. If you don't mind moving to the next slide and the next. So thank you all for being here. This is a heads up. We will be discussing hard things today. We will shout out the good things when possible, but I can tell you now that it might feel like we're glossing over a lot of extremely important and tough issues that deserve more time and space. This includes data on suicidality, drug use, and interpersonal violence. So this is your reminder to take care of yourself and think about what you're going to do for aftercare. We are currently posting in the chat a resource sheet with hotlines for support. You can also use the QR code or link on our screen to access this resource guide. This sheet also has links we'll be using during our presentation and a ton of other wonderful resources that we've compiled for you. At the end of the presentation, we will also be offering space for group discussion and debrief, so look forward to that. Finally, I want to mention that we will be mirroring the survey language, and that language is imperfect. So take care of yourself and let's move forward. Next slide, please.
Hello, everyone. Thank you so much for being here. I'm so excited to speak with you all about this exciting data. So let's see. So let's talk a little bit about the Promoting LGBTQIA Equity Task Force. Super exciting new initiative within ACHA. It's made up of mental health clinicians, medical clinicians, and health promotion specialists, health educators across the country. There's about 15 members, and we are charged with creating a white paper and guidance ultimately to support queer and trans students in college health across the country. So that includes providing suggestions for organizational improvements, and we really want to focus on strengths-based solutions. We know a lot of the disparities that exist that's not new. We really want to come to the table with solutions and talk about what is going well and how we can use the strengths of the trans and queer community. So currently we're reviewing existing guidance. We're doing a literature review with some student volunteers, and we're also working with NCHA data and also the NCHA advisory group and the ACHA research team to talk about how we might be able to add questions about gender affirming care on upcoming surveys, because we know that gender affirming care improves the quality of life and well-being and health of trans people. So it'd be great if we could get more information on that. So next slide, please. So we're going to be talking about why this is important, give some overview of the survey. We have a lot to get through. You're welcome to put questions in the chat, but we may wait to respond to them until the end of the presentation. Next slide, please.
All right, so there are a few things we won't be covering today. One is LGBTQIA+ terminology. If sexual orientation and gender identity is something you need more info on, Blake will be putting an LGBTQIA glossary in the chat. You can also find a lot of other information on the resource page that we posted earlier. We are also not going to be covering the entirety of the data sets or summaries. We want you to read those and apply your knowledge to that. We're going to be covering enough data during this, so please read those and learn more from them. Finally, we are not here to debate the existence or the validity of trans and queer people, full stop, period. All right, so why is this important and why are we discussing this now? Next slide, please.
So this is serious. We don't want to mince words when we talk about these things. The Human Rights Campaign, which is the nation's largest queer and trans rights organization, for the first time ever has declared a national state of emergency for LGBTQIA people in the United States. And so just as a history lesson about this slogan, silence equals death in the pink triangle, for anyone who's unaware, this was the slogan of ACT UP, which stands for the AIDS Coalition to Unleash Power. During the early days of AIDS, when thousands of queer and trans people were dying from AIDS-related complications and frankly being ignored by the government. So history matters, and it influences community trust in the systems that are built to serve and protect us. And so that mistrust and our need to unapologetically fight for our health and well-being are still present and relevant today.
All right, so right here we have a map. As a reminder, 2023 was a record-breaking year for the total number of anti-LGBTQ bills considered in the US. This includes bathroom bills, locker room bills, sports, regulations, health-related laws, and drag bans. It also includes cuts to LGBTQIA+ centers and national funding cuts proposed by the House of Representatives on HIV prevention and care. We know that anti-LGBTQ bills aren't the only bills impacting our students and our campuses. There were also a number of diversity, equity, and inclusion bills that restrict offices, staff, training, and more on campuses, and the Supreme Court ruling on affirmative action earlier this year. We also want to mention that students aren't the only ones impacted. Staff and faculty are also impacted by these bills. Next slide, please. This map shows the state of gender affirming care access for youth and was last updated July 2023. The states that are marked in red are the ones that have passed laws or policies banning gender affirming care up to age 18. We know that that's when students are oftentimes arriving on campus, and so that means that they may not have had access to affirming care up until that point. This can impact their mental health, healthcare priorities, and other aspects of their campus experience. We also know that multiple states, including Oklahoma, Texas, and South Carolina, have considered banning care for trans people up until age 26, which would greatly impact our students. Next slide, please. Today, we will be presenting data from the spring of 2022 And so as you can see from this timeline, the United States has experienced this increasing rise in anti-trans legislation, but now in 2023 is surging. So we won't be able to see the impact of 2023 in this data, but we expect that will have it extreme impact. Next slide, please. A recent study found that LGBTQ people are 4 times more likely than non-LGBTQ peers to choose a college away from home to find acceptance. We know that finances, familial support, and other factors can influence students' abilities to move. So it's important to remember that their capacity to attend colleges in safer states is hindered based on resources. That means for many queer and trans students, they are having to fight for their lives, the lives of their friends, family, and community, both on campuses and in state and national battles. Our students are at the forefront of this work, while also having to be scholars, friends, leaders, family members, and workers. These are our students, staff, and faculty. They are real people, and they are so much more than data points. With that, let's look at the data. Next slide, please. So we will be discussing 2 summaries today, one that covers cisgender and heterosexual students compared to LGBTQ+ students, and another that compares cisgender students and transgender/gender nonconforming students side by side. I want to reiterate that a lot of advocacy and work has been involved in getting this data, both through the committee and task force. This is the first time we've had this data disaggregated based on sexual orientation and gender identity. And I want to shout out the research team at NCHA for doing all of this work. It's so important. While we're still working with this data to find trends, we want to remind participants that you can request this data by following the link that Blake has put in the chat. The sample sizes are listed under the respective summaries, but please note that 1 in 4 students in the first survey ID'd as LGBTQ+, and 1 in 17 students who were surveyed identified as trans or gender nonconforming. So this is important. Next slide, please.
Okay, so let's talk about how the survey instrument measures gender identity and sexual orientation. So these were the survey questions related to assigned sex at birth and gender identity, which were then grouped and recoded accordingly for the executive summaries that this is from. So Lo will be putting the code book in the chat if you'd like to learn more about how gender identity was determined. Next slide, please. So similarly, these were the questions about sexual orientation and how that was measured. So one point to note is that if students wrote asexual, ace, or aces in the my identity is not listed above bubble, then they were recorded as asexual. And again, you can look at the codebook for more info on how this was collected. Like all surveys, there are going to be limitations. We also know that sexual orientation and gender identity exist on a spectrum. And so this survey doesn't encompass the complexity of that spectrum as no survey instrument actually would, right? So this is what we're working with right now. And there's always going to be room for improvement with any survey instrument. So this is what we're working with. Next slide, please. In terms of limitations, so the data shown, first, they're not stratified by other identities. This just looks at sexual orientation and gender identity. So we're not looking at these, I guess, intersectionally by also looking at race, ethnicity, disability status, first-gen status, et cetera, et cetera. So we're not able to report on the statistical significance of any differences that we describe. We're simply reporting proportions of each group that responded in a particular way. This also doesn't include qualitative data, which includes student stories. You know, as Lo mentioned, there are faces and lives behind these statistics. And so we're not able to share any of that here. We also don't have any information on any confounding variables that could help to clarify any of these differences between the groups. Of course, we can always speculate, but we haven't really specifically measured that. It's also important to note that we're not looking at in-group differences. For example, for sexual orientation, we're not comparing those who describe themselves as lesbian with those who describe themselves as gay or bisexual or queer. We're lumping according to what's in the survey as a group. Next slide, please. So I'm not going to go over a lot of this specifically, but the next few slides will describe this sample, that can be found on, I think, the last page of both executive summaries. So ultimately, you can find this yourself, but essentially 4 out of 5 respondents were 24 or younger, almost 2/3 were cis women, and more than a quarter did not identify themselves as straight. Next slide, please. Almost 4 out of 5 students were undergrads. 2/3 were insurance dependents who were under a parent or guardian's insurance plan. 1 in 50 respondents were veterans, and almost 6% were primary caregivers of children. Next slide, please. In terms of race and ethnicity, we can see that 30% of respondents describe themselves as a race or ethnicity other than white, with half of those describing themselves as Hispanic or Latino being Mexican, Mexican American, or Chicano, and 45% of those describing themselves as Asian being East Asian. Next slide, please. So for clarity and flow, we'll be presenting the data in categories that differ from how the executive summaries and the survey instrument itself are laid out. So as such, the category titles in our section are not going to be the official titles used in the summaries. So we're going to spend the next 30 minutes or so going over some data points that we found to be most impactful when attempting to highlight differences between groups. So it's going to be a lot, but whenever you see a chart, pay attention to the text that we added to the LGBTQ and trans bars. So the green numbers mean that there's a higher proportion than the comparison group, and red numbers mean there's a lower proportion than the comparison group. So they might indicate either the percent change between the groups or just the overall magnitude of the differences. And so now I'm going to pass it over to Lo to discuss findings around general health and healthcare utilization.
All right, thank you, Blake. So getting into it. To start, when asked to describe their overall health, a lower percentage of LGBTQ and trans students reported their health as very good or excellent when compared to cis het and cis peers. This means a higher proportion of LGBTQ and trans students were describing their health as just good, fair, or poor. Next slide. When asked if they felt that students' health and well-being was a priority at their college or university, a lower percentage of LGBTQ and trans students reported that they agreed or strongly agreed when compared to their peers. Next slide. When asked if they felt that the campus climate encourages free and open discussion of students' health and well-being, again, a lower percentage of these queer and trans students reported they agreed or strongly agreed. This highlights the importance of including students in discussions and work to promote health and well-being. Moving on to healthcare utilization. So when it comes to healthcare utilization, interestingly enough, we saw that within the last 12 months, both LGBTQ and trans students reported receiving psychological or mental health services at 2 times the rate of their cis het and cis peers. Similarly, a higher percentage of LGBTQ and trans students reported visiting a medical provider within the last 12 months. While we don't want to assume what's driving this, it could suggest a potential strength in demonstrating help-seeking behavior despite medical mistrust within the queer community. It could also be a potential point of contact for college health professionals when exploring service and resource options with queer and trans students. Next slide, please. An important follow-up to the previous slide is the proportion of queer and trans students that reported their ongoing chronic or medical conditions as impacting their academic performance. We know that discrimination within healthcare is common for queer and trans folks, meaning they might avoid seeking care, be denied care, have to self-advocate, and/or receive poorer quality of care. It's important to remember that these issues are amplified when it comes to intersecting identities like being queer, trans, person of color. This is another opportunity to consider how we are supporting these students in balancing access to medical care alongside academics. Now, Blake will get into the specifics regarding mental health. Next slide.
Thank you. And so here's just a quick reminder to take a breath, take care of yourself as needed. These are going to be some pretty heavy statistics. So next slide, please. So the Diener Flourishing Scale, this is a validated scale that can be found in the NCHA 3 instrument. It is an 8-item summary measure of the respondent's self-perceived success in areas such as relationships, self-esteem, purpose, and optimism. So the scale provides a single psychological well-being score, which ranges from 8 to 56, where higher scores indicate higher psychological well-being. So the mean scores for each group are shown here, and we can see that trans and queer students have lower scores compared to their cishet peers. Next slide, please. So the Kessler-6 is another validated scale in the instrument, which measures psychological distress using 6 questions around items such as, or constructs such as nervousness, hopelessness, sadness, and other feelings. So in this chart, the yellow bars show the proportions of each group that had scores indicating serious psychological distress. And we can see that trans and queer respondents were more than twice as likely to score for severe psychological distress compared to their cishet peers. Next slide. And so moving to how aspects of mental health negatively impact academic performance, which is measured by asking if something contributed to a lower grade or delaying progress toward a degree. This chart shows the impacts of anxiety, depression, and stress. So it's a lot to look at, but pay attention to the yellow and orange bars here to see the proportions for trans and queer students. So ultimately, we see that when compared to their cishet peers, trans and queer students were much more likely to report that their academics were impacted by anxiety, depression, and stress. Next slide, please. So impacts to academic performance when it comes to personal appearance. So this question could be interpreted in a variety of ways when the respondent reads it, but we do know that our trans students may be managing dysphoria, and that body image is a well-documented concern within the queer and trans community. So it's really important for us to consider how students are managing identity development during their time at college. For many students, that includes some form of gender expression as well. And especially for our trans and gender nonconforming students, accessing clothing that is both affirming and affordable can be a challenge. And also trying to find, quote, professional attire can be an added complication. So yeah, keep this in mind as we develop programs and initiatives. Compared to their cishet peers, we also see that trans and queer students were more than 2.5 times as likely to report that an eating disorder or problem negatively impacted their academic performance. Again, nothing really new there. That's been shown before. Next slide, please. Oh, I should have said next slide. This is the eating disorder or problem slide. So yes, there's that. Take a little mental picture. And next slide, please. So one of the largest differences between groups that we noticed was how much more trans and queer students' academics were negatively impacted by post-traumatic stress disorder. So when we look at this, we can see that trans students were nearly 4 times as likely to report this. And this really speaks to the importance of working to create trauma-informed environments across campus, from classrooms to health centers to our recreation centers. Any space we can find, we need to talk about how we can make it more trauma-informed. And so with that said, the next few slides are going to discuss self-injury and suicidality. So heads up. Next slide, please. So another stark difference in these data between the groups is around self-harm. So we see that trans and queer students in this sample were almost 3.5 times as likely to report self-injury. 3.5 times more likely. And this was nearly 1 in 4 LGBTQ students overall, and almost 1/3 of trans students. So again, 1 in 4 LGBTQ students overall, and almost a third of trans students. That's very startling. Next slide, please. So in terms of suicidality, the NCHA 3 measures this by using another validated 4-item scale called the Suicide Behaviors Questionnaire Revised, or the SBQR. So overall, half of LGBTQ students and almost a third of trans students were screened positive for suicidality on this scale. So trans and queer students were around 2.5 times as likely than their cishet peers to screen positive. And again, this information is really not new because increased risk of suicide has been well documented in the trans and queer community. But the question here becomes not how prevalent is it and how suicidal are they, but it's how are we helping to create policies and practice that help ensure LGBTQ students don't want to kill themselves? It's really, really that simple. And this is emergency, right? This is an emergency. Next slide, please. So similarly, when we look at the self-reported rates of attempted suicide for each group, we see that trans students are nearly 3 times as likely to report attempted suicide in the last 12 months compared to their cisgender peers. And so this was around 1 in 15 trans students in the sample. 1 in 15 trans students reported attempted suicide in the last 12 months. So overall, around 1 in 23 LGBTQ students reported a suicide attempt in the last 12 months, which was more than twice that of their cishet peers. Next slide, please. So, okay, sexual health. So next slide, please. So this is encouraging, but while rates of condom usage most of the time or always for vaginal and oral sex are similar across all groups, one encouraging data point worth mentioning is that higher rates of queer and trans students reported using a condom most of the time or always during anal sex. This is encouraging. Next slide, please. So moving on to HPV vaccination, another encouraging data point is that trans and queer students were more likely to report knowing that they had completed their HPV vaccine series compared to their cishet peers. And of course, we recognize that many college students were 11 or 12 when they received this and they may not remember. Nevertheless, this is a cool statistic. Next slide, please. In terms of HIV testing, we see that trans and queer students were considerably more likely to report that they have had at least 1 HIV test in their lifetime. Again, that's awesome. Next slide.
Wonderful, thank you. So now we are going to highlight just a few points that provide us insight into our students' environment, because we know the importance of support systems and perceptions of belonging on student well-being. Next slide, please. So when asked if they felt they belonged at their college or university, a lower percentage of LGBTQ and trans students reported that they agreed or strongly agreed. Next slide, please. In line with the previous slide, they were also less likely to agree or strongly agree with the statement, "At my college/university, we are a campus where we look out for each other." This question could be interpreted as peer support or more broadly amongst all people on campus, including students, staff, and faculty. Next slide, please. Given students' perceptions of belonging, we also want to share results of the UCLA Loneliness Scale, which is another validated scale that includes the questions: how often do you feel a lack of companionship? How often do you feel left out? And how often do you feel isolated from others? Queer and trans students had positive screenings at a higher proportion than their cishet and cis peers. Next slide, please. One important component of support for students can be family. However, for our queer and trans students, the data shows that a higher proportion had problems or challenges with family within the last 12 months. Of those reporting this issue, it also caused moderate or high distress at higher rates than with their cishet and their cis peers. Next slide, please. When surveying all students, queer and trans students more frequently reported family impacting academic performance. This is a really important thing to keep in mind, as students who may have moved to college to seek out safer and more inclusive environments may still be impacted by family and community back home. So once again, we think about our colleges as a bubble, but in reality, there's a larger environment impacting how our students are doing. Next slide, please. When considering, next slide, please. Wonderful. When considering potential support systems, it was also concerning to see that a higher proportion of queer and trans students report issues with faculty impacting their academic performance. Faculty should be improving academic performance. While there might be many factors at play here, we know that there is a power imbalance between students and faculty, especially in the classroom. Without getting into too many specifics, classrooms can be places where students experience dead naming, misgendering, and other forms of discrimination. Next slide, please. Unsurprisingly, when students taking this survey were given a definition of discrimination, and I want to read that to you all now, it is the unjust or prejudicial treatment of a person based on group, class, or category to which the person is perceived to belong. We saw that LGBTQ students were twice as likely and trans students were 3 times as likely to report discrimination impacting their academic performance. So it's very prevalent to our students. Next slide. In line with this, a higher proportion of queer and trans students report experiencing challenges and problems with discrimination, and of those reporting experiencing it, it also caused moderate or high distress at higher rates than their peers. When looking at the level of distress experienced as the result of an issue, it's important to consider how we are talking about and addressing these issues on campuses. What support do students have when confronting discrimination? This is a really good time to point out that Title IX is intended to protect students from discrimination based on both sexual orientation and gender identity. That being said, we know that not all students are protected by Title IX. Educational institutions can be considered for a Title IX exemption if following Title IX rules would conflict with religious beliefs. Now that we've discussed general belonging, social supports, and discrimination, Blake is going to review data around basic needs. Next slide, please.
Thank you. So next slide, please. So the NCHA 3 uses the 6-item USDA ERS food security scale, which asks questions related to food access and finances. So in alignment with many research studies done before, we see that trans and queer students were more likely to report experiencing any level of food insecurity. And I think it's also important to mention that when we look at the different levels that are categorized by this scale, trans and queer students were more likely to report higher levels of food insecurity, or more severe food insecurity, I should say. Next slide, please. Trans and queer students were also more likely to report that their academic performance was negatively impacted by their finances. So given what Lo described earlier in terms of family support, we know that parents can be an important financial resource for students. And some students may even choose not to disclose their trans or queer identity for fear of losing that financial support. So very important aspects to consider. Next slide, please. So similarly, higher rates of trans and queer students not only reported experiencing problems or challenges with finances in the last 12 months, but we also see that those problems or challenges were more likely to cause moderate or high distress when they occurred. Next slide, please. Trans and queer students were also much more likely to report that their academic performance was negatively impacted by sleep difficulties. This is not surprising, especially given what we know about how quality sleep is related to stress and anxiety. Next slide, please. So trans and queer students are also less likely than their cis-het peers to meet physical activity guidelines. For trans and non-binary students, this can be influenced on our campus by lack of restroom or locker access or safety in those spaces, or even the ability to participate in sports activities, right? So now I'm going to pass it back to Lo.
Thank you so much, Blake. So next we are going to get into discussions around power-based violence and feelings of safety. This includes discussions of sexual assault, harassment, and stalking. As a reminder, take care of yourself and remember to take a deep breath when you need one. Okay. So the next 4 slides detail questions when students were asked about experiences regarding that, The next 4 slides detail questions students were asked regarding experiences that occurred outside of intimate relationships, so not within partnerships. As we can see here, LGBTQ students reported experiencing sexual touching without their consent at twice the rate of their cishet peers. This is an important point to remind ourselves that LGBTQ students are not a monolith, and that research shows that the prevalence of power-based personal violence varies significantly within the community between lesbian, gay, bisexual, trans, and other queer identities. There are also significant disparities when we disaggregate data based on race and ethnicity as well. Next slide, please. When it came to students who experienced sexual penetration attempts without their consent, we once again saw a higher proportion of queer and trans students reporting experiencing this outside of intimate relationships. Next slide, please. Both our LGBTQ and trans students reported experiencing sexual penetration without their consent at 2 times the rate of their cishet and their cis peers. Next slide, please. Queer and trans students were also more likely to report being a victim of stalking. Next slide, please. This slide is reporting sexual violence within intimate partnerships. So it includes partnerships. The blue line here represents the percentage of students who reported that a partner forced them into unwanted sexual content by holding them down or hurting them in some way. The red lines represent the percentage of students who reported that a partner pressured them into unwanted sexual contact by threatening them, coercing them, or using alcohol or other drugs. This is an important reminder that intimate partner violence occurs within trans and queer communities, and we must consider this when creating services and spaces for survivors. This isn't an issue that only occurs between cis men and cis women in straight relationships, and I think that's so important to reiterate. Next slide, please. So when students were asked about the physical and sexual assault, a higher percentage of LGBTQ students and trans students reported that these experiences impacted their academic performance. This question was asked of all students in the sample, so it could reflect just a higher rate of these experiences, but it's also important to consider how LGBTQ students perceive support services around sexual and physical assault. Do they feel safe reaching out to Title IX? How are they received when they seek out survivor networks or support groups? Are there services on campus that are inclusive and safe for queer and trans students? Next slide, please. We found similar results when looking at the reported impact of sexual harassment on academic performance among trans and queer students, with both groups reporting a negative impact at over twice the rate of cishet and cis students. Next slide, please. Not only did LGBTQ and trans students report experiencing higher rates of sexual harassment as a challenge or problem, once again, they reported this challenge causing moderate or high distress at 15% higher proportion than their cishet and cis peers. Level of distress can be impacted by many things, including experiences with service provision. Next slide, please. Given these reported experiences, it's important to consider queer and trans feelings of safety on campus and within the community. So we see just on campus, a lower percentage of LGBTQ and trans students reported feeling safe both during the daytime and the nighttime. Next slide, please. We saw even larger differences between the groups when it came to feelings of safety in the community surrounding their campus during the daytime and nighttime as well. This is so important to pay attention to. Consider the communities in which your campuses are situated and how that impacts your students. We might think that our campus is a bubble, but for queer and trans students, they may have many reasons to leave that bubble. From basic needs like accessing affirming healthcare off campus, having a job off campus, or living off campus due to finances, to actively seeking supportive environments such as LGBTQ community groups, dating and relationships outside of the campus dating pool, and seeking joy or relief in queer nightlife. When you're supporting the well-being of these students, it's essential to pursue more inclusive campus environments and support them in safely navigating the world off campus. Now we're going to go through a few final data points regarding alcohol, tobacco, and drug use. Next slide.
Thank you. Okay, we're almost done with the charts. Just a few more. So first, let me say, substance use on college campuses, it's not just about alcohol and tobacco. And we need to make sure that we're addressing the other drugs part of that as well, even though that, even though usage rates may be less common. So with that said, we do see that trans and queer students in this sample were more than twice as likely to report using inhalants, both ever and in the last 3 weeks. Next slide, please. And similarly, trans and queer students were much more likely to report hallucinogen use. Next slide, please. We actually saw lower proportions of trans and queer students reporting problem alcohol use, and more use and higher rates of usage of cannabis. So here we can see trans and queer students were more likely to report that their cannabis use was impacting their academic performance. So that's something to keep in mind. Next slide, please. So in terms of students who are in recovery, we see that LGBTQ students and the trans student group were more than twice as likely to report that they were in recovery. So we know that we see higher rates of substance use among queer and trans people, as we've said. And we also have to think about how the spaces that are queer and trans inclusive, especially off campus, they're usually centered around the bar scene and there's alcohol and, so how can we build those really fun social connecting spaces on campus so that students can stay on campus and have fun. And we also know that drug use can be a coping mechanism, right? So when we think about alcohol, tobacco, and other drugs, we have to think about how that relates to stress, anxiety, depression, those things as well. Next slide, please.
All right, let's take a breath. As a reminder, we know and care about these students. Some of us even share these identities with students, and we might see ourselves reflected in some of these statistics. So let's take another communal breath before moving into the discussion. Okay, next slide, please. I'd like to share 2 quotes as a part of our discussion. The first is from Alok Vadmenon. It says, "Trans issues don't exist. There are issues that non-trans people have with themselves that they are taking out on trans people." We can honestly look at all this data and wonder why queer and trans students have so many issues. Or we can ask ourselves what we're doing to support systems that place so many issues on the backs of our queer and trans students. Addressing these health disparities requires a public health perspective. And if we aren't considering social determinants of health in the social ecological model when designing interventions, we will continue to fall short as college professionals. The data we present is also not the whole picture. We need to learn more and continue to disaggregate the data based on race, immigration status, class, religion, etc. This work requires special attention to intersectionality. Otherwise, we will continue to perpetuate disparities and further marginalize the students we seek to serve. Next slide, please. The second quote I would like to share is from Audre Lorde. "Guilt is not a response to anger. It is a response to one's own actions or lack of action. If it leads to change, then it can be useful, since it is then no longer guilt, but the beginning of knowledge." I share this quote because I expect that the participants may be feeling a wide range of emotions: guilt, anger, sadness, and for some, possibly indifference. And we know that how we engage with those responses can impact our future actions. One thing to consider when looking at this data is that it's not new. We've known that these disparities exist. They are backed up by a wealth of national data. However, it is the magnitude of the disparities that should sound alarms, and we can expect larger disparities in 2023 data as well. There are an overwhelming number of issues impacting our trans and queer students. It can be hard to know where to start. While it can seem like a lot, our universities and colleges can address these issues through coordinated efforts with student life, faculty, housing, campus health services, in coordination with community organizations. I believe that the first step to this is understanding our role and committing to this work. So for that reason, we would like to provide participants with a space to reflect. Next slide, please. So since we are all responsible for responding to the needs of our queer and trans students, we wanted to give you an opportunity to debrief and respond to the data that you've just seen. So if you can, follow the QR code or the tiny URL link to our Padlet. It is tinyurl.com/LGBTQIA data 23. Please take a moment to respond to 2 or 3 of the Padlet prompts. As a reminder, all of these responses are anonymous, and I also want to invite you to read through your colleagues' responses. This is also an opportunity where Joanne will be coming in and reading us out any questions, and you can also include questions in the Padlet as well. All right, and we are going to open up that space. If you have any issues with the Padlet, please let us know through the Q&A. All right, and as these come in, I'm going to try reading them out. I also want to recognize that we don't have as many people in this space as we expected. There's some technical difficulties going on, so please take time to respond. So some thoughts or feelings that came up when looking at the data, people saying sadness, but unfortunately not surprised or shocked. This is spring 2022 data. I fear what we'll see in 2023. Someone mentioned that the self-harm statistic surprised me. Thank you for sharing these. Someone shared that I feel sick and scared. I hear so many of my students' stories in these numbers. And another person that said, I'm glad that ACHA is looking at this data. Wonderful. Yeah, it's important. We're moving forward and we're creating data that we can use. As far as stuff that people would like to learn more about and what's missing in this data, where do LGBTQIA students generally feel comfortable / accepted on campuses? I think that's a wonderful question. It would be hard to measure, but what services have been helpful for students? Where do they feel supported? Yes, we really need this information. More info on histories of trauma. Looking forward to further disaggregating the findings. Yes, us as well. Oh, I love this. Would like to know more about how this data compares to college-age people who are not enrolled. This is a lot of the work that we're doing currently. And so I want you to know that you can get involved in a lot of different ways, and Blake will be covering some of that in our final reflection and recommendations. A lot of people, when responding to how the data reflects student experiences on campus, are saying that they're seeing the data is consistent with what they've seen. And then as far as actions go, I want to shout out that some people mention, I want to begin providing improved gender affirming care services at my institution. Wonderful. Sharing data with stakeholders that may help advocate for financial resource allocation. Wonderful. Yes, share this data. You have the summaries. I will share this info with my GAH team. Recognize the need to advocate for trans inclusion in sport and physical activity spaces. Yes, absolutely. This is so important. We know that these are spaces where our students can relieve stress, relieve anxiety and depression, and also take care of their bodies. Work harder at educating my staff and helping them understand the specific needs and challenges of gender diverse students. Wonderful. I want to keep an eye out for questions. Are we getting any questions, Joanne?
I was just going to pop in because this is a great question. So do you think that LGBTQIA students will start self-sorting, only attending colleges in certain states? What might happen to students who can't afford to leave their states? I know it's an issue that we struggle with. I'm in a really restricted state, and one of those ones that had, I can't tell you how many bills come up in the past year. And although we worked hard by institution to try to do a lot in the past, right? In the past 10 years, we did a lot to try to improve care. You know, I think this is definitely going to affect that one. I think you guys mentioned something about this, about, you know, how the percentage of students who the 4 times more likely to go to college out of state if they can receive care. What do y'all think?
Yeah, absolutely. I think it's funny because I'm living and working in Kentucky right now, and Blake is living and working in California. And so we definitely, that stat was that 1 in 4 LGBTQ students will move if they can. And so given that, we know that that will potentially impact students who have less financial security more severely than those who might have financial security, familial support, and other privileges. Blake, do you have anything you want to add to that?
No, I mean, I agree. I've heard my own students talk about how, you know, even with, for example, the abortion restrictions, how that influenced where they were going to go to grad school, even if they had decided on a certain state. So there's no doubt in my mind that queer and trans students will make similar choices.
I also wonder if queer and trans students might take more risks, financial risks, when it comes to leaving the state or moving somewhere else. They might take out more loans than they would previously, and that can impact them down the road or down the line. Thank you for that question. I see a question in the chat that's perfect for Blake. Is it possible to apply for / join the NCHA committee on LGBTQIA health and well-being?
Well, not the task force, however, because the task force is like appointed, but you can always come to our meetings. We'll put more information about that in a follow-up message. And also there's an LGBTQ health coalition that is chaired by Dr. Joanna Schwartz. That is open to all members to talk about these things. So I invite you to go to the LGBTQ coalitions and also come to our meetings as well. And I'm going to say one thing that we are working on as a task force, and Lo has been so instrumental in this, is an assessment for campuses. So be on the lookout for a campus assessment that we're sending out to try to see what programs are working and initiatives on your campuses. What are the top issues? How are staff supported? You know, all these things. So stay tuned in the next couple months. Hopefully we'll get that out.
There's another question in the Padlet. I'm wondering how a lack of programming around healthy LGBTQ+ relationships is impacting these numbers. Just something to think on for the future. It's a wonderful question and point. We're both sex educators, and so that's something we care about a lot, and needing to increase the amount of programming covering these issues. Any other questions on your end, Joanne? Oh, are there any recommended trainings for healthcare staff, specifically nursing and mid-level staff? We did Blake's HIV 101 course last year. Thank you so much. Blake, would you like to speak to that?
Yes, I would. And thanks for coming to another one. but so I always recommend this. It's a great starting point. It is not perfect, but the Healthcare Equality Index, there are so many best practices and resources in there. So just Google it, Healthcare Equality Index. It's through the Human Rights Campaign. And yes, and it's on the resource sheet. Thank you, Lo. Lots of resources on that sheet to check out, but definitely the Healthcare Equality Index, I would start there.
And they have links on their website to a number of things that are appropriate. So I'm a nurse practitioner. There are a number that are really super appropriate for our healthcare staff.
Yeah, and you can also go to the Fenway Institute, which is also on that sheet, but it's the LGBTQIA Health Education Center. And you can get continuing ed credits for those too, and it's free. It's all free and open. So yeah, good starting points.
Amazing. So I want to thank everyone for participating in this Padlet. We want these conversations to start here and then move out throughout your campuses. So please take these conversations, these questions, these executive summaries to your campuses and continue these conversations. All right, now we are going to move into recommendations, and Blake is going to see us out.
Yes, okay, so just a few more slides here. So promoting trans and queer equity means working to eliminate heterosexism and cissexism wherever you find it. That's ultimately what this is about. That's the ultimate goal. So when we see where trans students or queer students or both are disproportionately impacted, let's dig a little deeper and let's see how we can fix that, alleviate that. Next slide, please. So first, I think what you can do is just ask yourself how you can make trans and queer students more visibly supported. Again, not just supported by policy, but let them know that those policies support them. How are they more visibly supported in all of your efforts? And then do those things. Which brings me to collect sexual orientation and gender identity data and analyze it accordingly. If you don't ask about sexual orientation and gender identity, you are not going to know what queer and trans students need, because you're not asking those questions. You have to ask and then measure and analyze. Also take time to absorb existing data and guidance. There's a lot there already, and much of it is on our resource sheet. So read it, take it in, think about it, and then act accordingly. Next slide, please. Also, let's see. Oh, here we go. Lean much more heavily toward being proactive instead of reactive. One of my biggest peeves about higher education and the bureaucracy is that we tend to err much more on the side of caution and emphasize risk management more than prevention and taking action before something's a problem. So be proactive. Prevention, we love it. Also listen to your students because they know what you need. This goes with the next bullet, which is incorporate an intersectional lens. As Lo has mentioned, especially previously, don't just go talk to your LGBTQIA resource center. Don't just have a focus group for queer and trans students. Like every student has intersectional identities. If you're lucky enough to have the resources to have a resource center for students of the African diaspora or Chicanx Latinx resource centers, go and talk to those students as well, because there's going to be queer people in those spaces. So talk to them in every space that you can. And then also hold people accountable. We can have the most beautiful, inclusive policy about supporting queer and trans students, but if those policies are not supported by people on campus for holding people accountable to those policies, they're not going to do anything. So yes, make those Title IX reports. Report hate and bias on your campus when you see it. And it's gonna be hard for you to do, but I know you can do it. So yes. And so to close it out, next slide, please. Here's the resource sheet again, if you don't see it. So thank you all so much for being here. We hope you learned something and we look forward to working with you more.
And quick reminder, just please go back to the ACHA Education Center to complete your post-test and evaluation. Thanks so much for a great presentation.